Good afternoon. My name is Connor Smith. Can you say your name for the record, please?
Good afternoon, Connor. My name is Grace Jordan.
And what is your candidate number, please?
My candidate number is 23050246448.
Thank you. And you are taking this test as a nurse, is that correct?
Correct.
Thank you. Can I see your passport, please?
Sure.
We can now start the warm-up question. How would you handle a crisis, such as an outbreak?
In my last role as a public health nurse at the city's health department, I noticed an unusually high number of patients coming in with similar symptoms. I lead a team to collect and analyze the data. It turned out that there was a small outbreak in our city. Because of our team reporting, the staff in our facility detected the symptoms and followed standard infection control precautions. Authorities were able to alert the public for symptoms to watch out for. I feel our team did a great job observing our patients and reporting the incidents.
How would you handle a patient who struggles with pain management?
In my role at City Hospital in obstetrics and gynecology, I remember a patient who was experiencing pain during pregnancy. I suggested different sleeping positions and stretches, but they did not help her. In that case, I reported the information to her doctor, who was able to recommend further treatment. The next time she came in, she was excited to report that the treatment was working, and she rarely experienced any more pain. In other settings, I have been able to offer comfort measures to patients like extra pillows or help with the television while they wait for their doctor to arrive. I always take patients seriously when they tell me about discomfort.
Describe a time when you were particularly proud of your healthcare team. What was your role in this situation?
Working in the ICU setting, there are countless moments that make me proud to be a nurse and proud to be part of this amazing community. Watching a patient survive a code, take their first steps on prosthetic legs, or being in the room when a patient I told they are receiving a new heart are the moments we all want to be a part of. Even if I am not delivering the news or care personally, the information my patient receives directly affects me.
Talk about a time a patient or their family were particularly pleased and appreciative of your care.
Working in pediatrics can be challenging, but also very rewarding. There are times that parents are unable to stay at the bedside 24/7 because of work, other children, or previous commitments. I was taking care of a 6-month-old twin during a specific shift. The family was unable to be at the bedside because the father had to work and the mother was at home with the twin sister and the other children. I spent my shift playing with the infant with age-appropriate toys, and when the mother called to check in, I put the phone next to the infant. The mother was able to hear her baby laughing while singing to her. This brought them closer together and the mother to tears. She stated that no other nurse had done that during the hospitalization, and she was eternally grateful.
Give me an example of an awkward situation at work. How did you remove yourself from the situation?
I once had a teenage male patient make very inappropriate sexual comments towards me. At first, I ignored them thinking it was a one-time thing. The second time, I told him that the comments were inappropriate and I did not want him to say those things to me. The third time, I left the patient's room and went directly to the charge nurse. I explained the situation and how uncomfortable I was in that specific situation and caring for the patient. She gathered a team to speak to the patient. My assignment was switched for the remainder of the shift.
That's the end of warm-up session. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good evening. I'm Grace Jordan, head nurse in charge today.
Good evening, nurse.
For my confirmation, shall I know are you Mr. Dwayne Smith who underwent bunion surgery an hour ago?
Yes, you are right.
Alright, so how are you feeling now?
Yes, I feel pain even when I make small movements.
I can understand your situation. Pain is quite natural. It's just an hour past the surgery, right?
Yes, I know.
Don't worry, your pain will subside.
Yeah, it may. But how to get rid of this pain completely?
I know you are quite upset, but the pain will decrease gradually.
Alright, now shall I get some tablets for pain?
Yes, don't worry, the doctor will prescribe some painkillers which you will have to take for a couple of weeks.
Thank you. But I want to speed up the process of healing. Can you tell me what I can do for that?
Yes, I appreciate your concern. The only way that you can get a faster recovery is through following a proper medical regimen and adequate rest. However, it will take time, and you will have to be patient.
Okay, so could you please tell me that how long really I need to walk without feeling any kind of pain?
It might take nearly 2 weeks for you to walk considerably well.
Oh God. Over 2 weeks to move well without pain.
I realize your feeling, but after a week or so, you will be able to walk with the help of a walker.
And what do you think, nurse, about how much time I will take to recover from this?
Well, it depends on you. Normally, patients recover after a week or 2. It all depends a lot on the way you take care of yourself.
Can I get some advice for a speedy recovery, please?
Don't worry. We will help you with it. We will teach you some exercise for your leg, and also I'll explain how to take care of your leg.
Thank you. That will be a great help for me.
We will also provide some medications and dietary patterns which will help you in speedy recovery.
That sounds good. Now I feel less tense.
That's great to hear. Anyways, all the exercises that you need to perform will be explained to you by our physiotherapist.
All right.
You should listen to the doctor and should do it without any failure.
Definitely, I will follow everything because I need a faster recovery.
Good.
Is there anything that I need to follow after discharge?
Yes, you should avoid taking a shower for the first 2 weeks, and as I said before, taking bed rest is really a necessity, and you will have to wear your post-operative surgical shoes all the time.
Okay, that's fine, I will take care of it.
In addition, please do not try to walk without any supervision for the initial week. If you feel any difficulty after discharge, please feel free to contact us.
Sure, I will.
Okay, I hope that the information that I gave you is clear.
Yes, it's clear and I will follow the suggestions and advice that you provided me.
Is there anything that I need to answer for you?
No, not for now. Thank you.
Alright, I'll explain the medications once the doctor has prescribed it for you.
Oh, that is nice, thank you.
Alright, I will see you soon. If you need anything, you can press the bell on your right-hand side. Any of our nurses will come and assist you.
Okay, thank you.
You are welcome. Have a speedy recovery. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.